About 10 years ago, I started a conversation with a classmate of mine here at UC Berkeley that has brought me back to my alma mater today. My friend and I had just returned from our summers abroad, his in the West Bank and mine in West Africa. And as we exchanged stories about our student projects from the summer, we couldn't wait to enter the real world, to start making some real change. But little did we know then, one of us had already come up with a solution for global change. A simple solution that could save people from the #1 cause of death in the world. I wish I could say that person was me, but it was actually that guy up in the tree. My friend Daniel, and founder of Microclinic International, with whom I now work. So, to start, what is the #1 killer in the world today? Even though both my friend and I had just returned from conflict-ridden, poverty-struck countries, the answer to this question is not war or malnutrition, it's chronic disease. Chronic disease includes cardiovascular disease, diabetes, HIV, basically anything that is long-lasting and requires long-term care. Chronic disease causes 60% of deaths worldwide, and of these deaths, 80% occur in low and middle-income countries. So, what's the solution? Contagion. This looks like the problem, but in fact, it is also the solution. When people think of contagion, they typically think of infectious diseases, like the flu, or HIV, or anything else that spreads from one person to another. However, research has shown that even non-communicable diseases, like diabetes and obesity, can spread from one person to another, because this is socially contagious. If you think about it, this makes common sense. If your friends smoke, you're more likely to smoke. If your friends eat junk food, you're more likely to eat junk food. The good news is that if bad behaviors are contagious, then so can good behaviors. And this is what we at Microclinic International call contagious health, or more broadly speaking, social contagion. So utilizing this social phenomenon, we develop microclinics around the world to tackle chronic disease in under-resourced communities. So microclinics are not bricks-and-mortar hospital clinics. Instead, they utilize a resource that is far more valuable and present in every community, no matter how poor. And that is human beings and their capacity for change. So microclinics are not buildings. They are social networks of individuals who come together to tackle a life-threatening disease. The first microclinics were developed in the West Bank as a student project to address diabetes. Diabetes is a huge problem in this part of the world. Of the top 10 countries with the highest prevalence of diabetes, 5 are in the Middle East. And in this area, burdened by conflict and lack of access to healthcare, we saw community members come together to share access to glucometers, health education, and social support. And news of the program spread to neighboring Jordan, where we are now expanding the model at a national scale. And research on this program is showing that the average participant is sustaining a 1-point drop in HbA1c, or blood sugar, years after the initial intervention, a change that could be life-saving. So as we expanded the microclinic model across the Middle East, we started to ask ourselves if this concept of contagious health is unique to Middle Eastern culture. And we found that the answer to this question was no when we brought microclinics to a very different part of the world, to Appalachian Kentucky, in order to address diabetes as well as obesity and heart disease. In the former coal mining towns where we work, these areas suffer from some of the highest rates of poverty and chronic disease in the nation. An area with limited access to healthcare specialists and healthy foods, we saw many of the same challenges we encountered in the developing world. However, through this contagious health model, we started to see changes spread throughout the community. People started drinking unsweetened tea instead of sweet tea, baking chicken instead of frying it. And this is Kentucky, home of Colonel Sanders we're talking about. And not only that, but not only were the participants in our program starting to change their lifestyles, but their extended social networks were as well. One neighbor of a participant who we had never even met lost over 50 pounds simply by joining in some of these healthier lifestyle practices. And by the end of a randomized control trial that we were conducting on the program, we found that 95% of program participants who completed the program improved in at least one chronic disease risk factor. So as we expanded the microclinic model from addressing diabetes to some of its common comorbidities, heart disease and obesity, we started to ask ourselves if this model would work for a very different type of chronic condition, and that is HIV/AIDS. So turning to Lake Victoria, Kenya, we brought the program to an area that suffers from some of the highest HIV rates in the world. And in this rural Kenyan community, we discovered that the microclinic contagious health model doesn't only help people change behaviors, but also attitudes. In addition to helping program participants adhere to medication schedules and exercise healthier lifestyle practices, the intervention also helped reduce the stigma of HIV in the community to the point where 86% of participants who completed the program were willing to openly disclose their HIV status. And to fully understand what this means, I want to ask the audience a question today. How many of you have an STD? I don't see any hands raised, but imagine 30% of you did. And now imagine that this disease was essentially a death sentence, and that unless you were willing to raise your hand and ask for help, you would potentially die. So you see, by changing the way people think, we can give people a new chance at life. So the microclinic model has been shown to be an effective agent of change across cultures and across diseases, starting from one disease and then expanding to many diseases. But not everyone here today plans to make their change through issues of global health. So I want to share with you how can you use the social contagion model to be an effective tool for change for your cause as well. As an example, I was recently in Egypt to try to address the diabetes epidemic. But what I found was a disease that was much more pervasive, and that is a disease of sexual assault against women that was happening throughout the political protests and every day in the streets. However, to combat this problem, social movements started to try to change the behaviors and attitudes of society so that it would no longer be okay to be a perpetrator or a bystander. So through one person, a small group of people, and then a larger group of people, an entire society can change. So whatever your cause may be, whether that be health or gender equality, human rights or faith, the change starts with you. Here at Microclinic International, we have a saying, I can influence my health, I can influence the health of those around me, and together we can influence the health of the entire community. However, this is something that a wise philosopher figured out a long time ago. Confucius once said, to put the world in order, we must first put the nation in order. To put the nation in order, we must first put the family in order. And to put the family in order, we must first set ourselves right. So the only fortune that comes with this cookie is to be the contagion you wish to see in your world.